What's up, you guys? This is your boy Miguel giving you your daily dose of radiation. Today's video we're covering how hard is it to cross-train to other modalities on your job. So to give you context, I'm an X-ray tech at a trauma 3 hospital. I've been doing it for 4 years. I work a lot of day shifts, so I do dabble in day shift. So I would say cross-training, usually as an X-ray tech, the most easiest one that will come to mind is CAT scan, because several things are kind of similar position wise, and then there's other niche topics where CAT scan will differ and it becomes slightly more harder or more like anatomy focused, like very tiny, like contrast and a bunch of other stuff. But like that's more of a like easier transition compared, like if you're going to go to IR or you're going to go to like some other or cath lab, like it's a little bit different. Some places offer cross-training. It's not as common as it used to be due to regulations and stuff. Most places don't want to take on the liability. They want you to already have your certification and training and stuff. Certain places still allow it under guidance of other certified techs, or to be honest with you, it all depends how desperate they are. If they're really desperate, you could end up getting cross-trained, just saying. So I would say it can kind of vary. You can either still work as your normal X-ray tech hours, and then kind of you would dabble like on your days off, or like when you're like taking your rest days, you could pick up some shifts here and then in training on your opposite schedule or on the weekends. Or certain techs will choose to, if like they work the 8 to 4:30, like the 4:30 to 8, the afternoon shift type deal, they'll like train a few hours. That's kind of the most common thing that happens. Other times you full on will leave your X-ray department and just kind of fully transition over. It all depends on staffing and a bunch of other stuff that are kind of situational based. And of course, while you're training and you're still not certified, your pay will be slightly higher than X-ray, but not as, because you're not a full tech, like a full CAT scan certified. So they'll like maybe pay you a little bit more, and then they'll give you maybe a set amount of time that you have to sit for boards. And then if you don't pass boards, they'll probably sit you back to X-ray department, or they'll just extend your training. It all kind of varies on depending on where you work at. And some places, like if you're already X-ray tech, like the CT and X-ray do both. So like if it's slow and busy, they'll kind of like focus you more on CAT scan and like try to help you there. So yeah, that's where we go. See you on the next one.